Dear doctors, a very warm good afternoon. I welcome you all again on this Homeopathy 360 platform. We are again with come up with new personality with a new topic. So without wasting much time, I request our presenter Dr. Yashika to start the proceedings and let's start the webinar of today.
Thank you, sir. Thank you, Dr. Rajesh. Uh, so here I welcome everybody to the webinar. We have a good number of people today joining us. Hello, everyone. Good afternoon, and welcome to today's webinar by Team Homeopathy 360. Hope you all are safe in this lockdown period and consuming your time very constructively. So, I would like to welcome you all to today's webinar. For all of you joining us and already joined, I, Dr. Yashika Arora, will be the moderator of today's session for all of you. But before we begin, let me acquaint you with the members of our team who will be working behind the scenes to ensure that the webinar runs smooth and there is no technical issue. I welcome Dr. Rajesh sir with us, who will be at the backend system to ensure that the webinar runs smooth and not testing much of our patience. So I would like to introduce you to this webinar platform. Whoever is new to this software, I would like to tell you that you have a chat box on the right side corner of your screen, wherein you can type your questions and send to us by pressing the button next to the box. After the session is over by our speaker, we will be running a question answer session to clarify all your queries. In between, the questions can be posted, but yes, they will be discussed in the end of the webinar. You can also raise your hand if you want to ask the questions from the speaker. You have a option on the right hand corner of your screen. And also, I would like to welcome you all to our platform of Homeopathy 360, www.homeopathy360.com, which is one of the most updated portals for all kinds of course material, latest news, events, research updates, and all types of articles, blogs from different practices all over the world, journals like Homeopaths and Homeopathic Heritage. We have always tried to keep it as an exceptional education hub for each generation of homeopaths and connect all the homeopaths worldwide by organizing each and every single information related to homeopathy and make it universally accessible, as well as through these webinars during this lockdown period, so that we can share our knowledge with each other. So, on behalf of my whole team, I invite all the esteemed homeopaths to contribute your area of expertise also to the portal. If you want to get published any of the articles, blogs, or any sort of material, you're always welcomed. You can mail us at yashika@homeopathy360.com. So now, without wasting any more time, let me introduce you to the dignified speaker of today's webinar. We have Dr. Arpita Chatterjee, ma'am, with us. She is the Associate Professor and HOD in the Department of Pathology at Parul University Institute of Homeopathy and Research, Vadodara. I welcome her to this platform. Thank you, ma'am, for taking out time today and guiding the audience. Her topic would be pathology and microbiology in the light of miasmatic approach of homeopathy. So she will be discussing the modern concepts of pathology, microbiology, parasitology, virology, and their effect on the immune system. Plus, she'll be discussing the new terminology of modern pathological changes to the old nomenclature. So, I think we will get to learn a lot and we'll get to learn something new. So, I hope everybody is excited. Now, let's begin the webinar without wasting any more time. Ma'am, welcome. Over to
Thank
you.
you. Thank you, ma'am. Uh, Good afternoon to every one of you who are present over here. Every session should start with a gratitude. That is what I believe. So I'll start this session with a vote of thanks first, though it is always at the last. But I feel that everything should start with a gratitude, because whatever we are having today, if we are having life to live and air to breathe, that is more than enough. So I would like to extend my thanks to my Dean of Homeopathic Faculty, Dr. Purav Desai sir, my principal, Dr. Panda sir, for his constant encouragement and guidance. I would also extend my thanks to Mehta sir for promoting my session in his college at Rajkot, and also to Hina ma'am, the principal of Ahmedabad Homeopathic Medical College. I also extend my thanks to all the colleagues who have always guided and supported me. And with this, I welcome you all to this session, which is about homeopathy and microbiology in the lights of my miasmatic approach of homeopathy. So what is the session going to be about? We will see and talk about it, and I think it would be more of a understanding of how homeopathy could be actually said to be a very advanced kind of science which was not understood then, and probably with all the advancement which are taking place with new instruments, with the new advancement in microbiology, in immunology, in parasitology, in pathology, and in clinical arena. So with this, what you get to see is that there is a science which shows that homeopathy was far ahead of its time. Unfortunately, it was not recognized then, and somewhere over the time it is gradually being expected to be understood in a much broader aspect. Now, before the starting of this session, I would say a small quote. There is a quote which goes like this. It says that I know what I know, and rest is imagination. So, so that's why I will ask you all to keep an open mind, because if you keep an open mind, it will be very easy for you to understand the things, or else it would be a little more, imagination for you. So please keep an open mind, try to evaluate the things, and enjoy the session. So I'll start with the presentation first. So I hope you all are able to see the presentation.
Yes, Dr. Arpita, the presentation is very clear, and I believe audience are able to see it properly. So you
I
can
hope
keep continuing.
the audience are also able to see it.
Yes.
Okay, fine. So now this is the, so I'll go to the second slide. This is just the introduction to the topic, that is pathology and microbiology in the lights of miasmatic approach of homeopathy. There might be many people who have joined today in this session who might not come from a homeopathic background, could not be a doctor as well. For them, I would like to say, now when you try to understand what is pathology, it is a study of diseases or the suffering. And when we are talking about microbiology, we are basically talking about the microorganisms like bacteria and viruses, and parasitology to a certain extent. And when we are talking about miasmatic approach, so this is basically a philosophy, homeopathic philosophy, which was given by Dr. Henneman 200 years back to make people understand the process of disease, chronic disease. So that is what the concept is. And now we will try to correlate the two things. And also I will try to make you understand it in the lights of homeopathy rather than going towards pathology more. I will try to make you understand that yes, in homeopathy it was already said, but pathology is proving that. So I think you will enjoy this thing. Is the next slide visible? Okay, so yes, so the objective of this entire thing would be just four things we would be looking into. So first is the understanding of the modern concept of what is pathology and what is microbiology. Then secondly, we would try to understand the classification of the diseases, the homeopathic classification of disease. And thirdly, we will try to understand the miasmatic understanding of it. And lastly, we will try to integrate the two things in terms of miasm. So I hope with this, we can begin the session now. Okay, so now when you ask me about what is pathology, as I told you, the word, it comes from a Latin word, patho. Patho means sufferings, the study of the suffering. And logy means the study. So when we are trying to study something which leads to suffering, like disease, ease means you are comfortable, and dis-ease when you are not comfortable. So that is disease. So when we are doing a study entirely focused on the disease, that is known as pathology. Now, basically what we do in pathology, what is the fundamentals or the fundamental dynamics on which the pathology subject is based on? So there are three things, only three things. मेरे पास बहुत सारे बार ऐसा होता है that students come and ask me, ma'am, this is a very tough subject, because they do not understand what is basically this subject related to. It's not a tough subject as such. It is a really easy one. Only you need to understand that why you are studying this. Why? So there are three aspects in which the pathology deals with. Only three things. First, it deals with the structural changes. The structural changes means the changes which are happening in your organ. For example, अगर आपको बुखार आता है, तो you have temperature. So your temperature has become different. So that is the structure. So it is something which is visible to our eyes, something which you can see. So structural means the changes. Disease के कारण जो change हुआ है, the change in the organ or the tissues or the structure, that is known as the structural change. So we go for the structural change. Grossly हमें पहले structural change दिखता है इंसान में, in any body. So first of all, you see the gross changes, the structural changes. Okay, so if we talk about cardiomegaly, meaning what? The heart has enlarged. So this is not normal. It is enlarged from its normal size. So this is not a normal thing. So that is known as what? It's a pathology. So that is a structural change. Now the second comes is biochemical. So how did it become large? You know, there might be something going on behind the scene. That's why it has become larger. For example, let me tell you one thing. If you're having difficulty in breathing, suppose you're having difficulty in breathing. Now we all know that our blood has a normal pH, which is not acidic. It's towards little alkaline. It is not acidic. The pH of our blood is not acidic. But the moment it becomes acidic, what happens is that you try to have this problem of breathlessness, nausea, vomiting, dizziness. There are different symptoms which can come out, right? So what is the biochemical change? What is the biochemical change that is taking place in the cell? The change that is taking place inside your body is that your pH has become negative. It means it has become acidic. Now, this is biochemical change. All right. So in biology, we even try to understand, okay, why this happened? Why the person is having difficulty in breathing. So we'll try to understand the biochemical aspect of it. All right. Then comes the functional aspect. Now, what do we understand by the functional changes? Now, functional changes means because of this, what is happening to the functioning. Now, you can see the first thing which happens was that you were having difficulty in breathing. Now, this is the functional change. Because of the acidic, because the pH became acidic, so you're having difficulty in breathing. So that is a functional change which is taking place at the level of the body, which you can see at the level of the cells it could happen, at the level of the tissues it could happen, at the level of the cell ke level pe kya hoga? Anaerobic respiration anaerobic respiration is taking place instead of aerobic respiration. Meaning kya hoga? That, for example, ke liye aapko samjha rahi hu, when you go for running, हम जब running करने जाते हैं, and you run for 10 minutes, 20 minutes. Now 10 minutes तक भागते भागते there would be a time, and when you go to 20, there will be a time when you will feel fatigue. आपके पैर दुखने लगेंगे, you will not be able to run anymore. Now what is that? Now, and your muscle will become very stiff, or it will start shivering. Your calf muscle will start shivering if you run any more than that. Okay, so and you will feel like you will collapse. अगर आप continuous 20 minutes तक run कर रहे हो तो. So now what is happening? That is something which is happening inside. Now what happened? When we keep on running, basically when we are running, the muscles require ATP. Now what is ATP? That is energy. The body requires energy. Now that energy को use करने के लिए, what do we require? We require oxygen. But when you are running, suppose you're running, you know one thing, that the oxygen supply to the body will be reduced. It would not be the same. All right. So when it is reduced, so what will happen now? The body will go into a stage where the oxygen has to be, because the oxygen is not present, so the body goes into an anaerobic mode of respiration. So now instead of aerobic respiration happening, the body switches itself to an anaerobic respiration, so as to produce ATP, because your body requires energy. Now, when that happens, your body has an excessive production of lactic acid. And when this lactic acid produce increases, the pH of the blood decreases. Acid आ गया तो आपका pH जो होगा वो acidic हो जाएगा, so your pH of the blood will decrease, and now this will lead to the pain. So that's the change which is taking place at the structural, then the biochemical, and the functional level. So in the functional level, what will happen? You will not be able to run anymore now because of the pain. Now you will not be able to run. So this is the basic understanding of pathology. So whenever we are trying to learn pathology, we are trying to understand three things. One, we are trying to understand the structural changes. Second, the biochemical changes, and third, the functional changes. Okay, so now we'll go to the second slide, other slide. So when we are talking about the study of pathology, we are actually talking about 5 things. Okay, so कोई भी चीज आप जब पढ़ते हो या कोई भी चीज होती है तो आप पूछते हो उसका why, then you ask what, then you ask how, then where, and then what happened then. Okay, normally we ask how, what, why, where, and when. Interestingly, यहाँ पे when का answer नहीं, and I'll tell you why we don't have the answer to when. यहाँ पे answer है why. Now the why is when we are studying pathology, we are told about a word called as etiology, meaning the how the disease is being produced or caused, causation of the disease. So that is etiology. That is the why. All right. So how it was caused? It could be some bacteria, some virus, some environmental factors, some stress, some food, some drugs, some immunological factors, etc. That is etiology, the causative factor of the disease. Now, second we have is what. So what is the disease? What are the disease? So when we are talking about what are the types of disease or what are the disease, we are actually talking about the classification of the disease. So how is the disease being classified? Uska classification kya hai? All right. So we will go into that later on. So classification. Then when we are talking about all this, we also talk about another thing that is known as pathogenesis. That is how. Now we understood that why the disease occur. Okay, so the cause we know. We know what are the classification. Now the main thing in pathology we also study about is the pathogenesis, meaning the mechanism by which this pathology is occurring. ये जो abnormality आ रही है आपकी body में वो क्यों आ रही है? What is the reason and how it is occurring? कैसे एक के बाद एक क्या हो रहा है बॉडी के अंदर जिसके कारण आपका जो सेल पहले नॉर्मल था वो एबनॉर्मल बन गया. So that is known as how, the process of how, that is known as pathogenesis. So we understand that. And once there is change at the structural, at the biochemical, and the functional level, now these three will lead to a change where in the morphology of the organs. So morphology meaning the structure. Organ में कहीं पे change आ जाएगा. So lastly in pathology what we understand is क्या change आएगा. लिवर बड़ा हो जाएगा या हार्ट बड़ा हो गया या छोटा हो गया, क्या हुआ? So what will happen? So why meaning हुआ, what that is, where is the why is the problem, meaning what is the cause which is leading to this disease. Second, we will try to understand what are the types, like what is the classification when we are classifying the disease, what are it. The third we try to understand is the pathogenesis. So when we are talking about pathogenesis, we are actually looking into it like क्या चेंजेस आ रहे हैं बॉडी के स्ट्रक्चर्स में, क्या चेंजेस आ रहे हैं जिसके कारण योर बॉडी इज एक्टिंग एबनॉर्मली और यू आर हैविंग दिस डिसीज साइन एंड सिम्पटम्स. एंड देन लास्टली व्हाट आर द चेंजेस दैट यू सी इन द ऑर्गन. एंड नाउ बिकॉज ऑफ दैट चेंज how will it be reflected? It will be reflected to you through clinical sign and symptoms. Okay, so आपको clinical sign and symptoms दिखेंगे, या आप when you go for some pathological test, like आप blood test कराओगे तो आपके blood test में कुछ abnormality दिखेगी, urine test में कुछ abnormality दिखेगी. So that is the ultimate result of an abnormal process. So it starts with the cause, then we go for the classification, then we go for the pathogenesis, then the morphological changes, and then what happens. Okay. Now the question is, इसके बाद, so why, how, when. Now when का आंसर नहीं है हमारे पास. See, over the years we have been trying to make you understand what is disease, how it happens, when it will happen, that is not known. So in today's scenario also, आज की condition में भी, if you see COVID-19, we know that there are viruses around us. It is there. If it can be communicated from one person to another person, it's a communicable disease. But when will I have that COVID-19, or you will have that, nobody can predict. Nobody can predict. Okay, so that prediction, as of now, we have not been able to do. So when ka answer dena is a little difficult at this stage. Probably after certain years of, maybe in future it would be able for us to do it. I can't say for sure right now, but maybe in future. But as of now, we cannot predict the when it is going to happen. When are you going to have the cardiac arrest, or when are you going to have typhoid? That is not for us to tell. As of now, we cannot predict that. Suppose हम कर सकते थे तो अच्छा रहता, but unfortunately we cannot do it. So now we'll go to the next slide. Can you see the next slide? Okay, so I will now ask you all to see this cell structure, because this is very important. If you understand the cell structure, whosoever can understand the cell structure, then understanding pathology becomes very easy. I'm telling you, it is damn easy. बहुत आसान है, बिल्कुल भी इसमें कोई, it is not a rocket science. Of course, अगर rocket science होता तो today we would be having a conference of the rocket scientists. So it is not rocket science. It is purely basic understanding. But simple understanding है. You need to just understand cell. आपने 11th में या 12th में you would have studied biology. If not in 11th, 12th, you might have studied biology in 9th or 10th, 8th standard, 7th standard. So there they teach you about the cell. So the cell structure. Now, one need to understand the structure of the cell. If you understand it well, you will understand where the problem happens. When we're talking about a normal cell, जब हम normal cell की बात करते हैं, तो a normal cell, as you can see, will have a cell membrane. Okay, then it will have the cell, within the cell membrane there will be cytoplasm, the fluid, and within the fluid there would be organelles. So you can see different organelles, of which the most important is, of course, the mitochondria. Now mitochondria, if you remember, it is basically for production of ATP. Okay, तो सेल में एक होता है आपका सेल मेम्ब्रेन, उसके अंदर साइटोप्लाज्म, एंड साइटोप्लाज्म के अंदर ऑर्गेनेल्स होते हैं. एंड all of us, whether it's me or you, are made up of these cellular structure together. So one cell, when it combines with other cells, they form a tissue, and when the tissues combine together, they form an organ, and when the organ, multiple organ system becomes a body. ये आपको याद होगा, इन 7th 8th स्टैंडर्ड में को पढ़ाया जाता था. So cells, one cell, multiple cell से बनेगा टिश्यू, टिश्यू से बनेगा ऑर्गन, ऑर्गन से मल्टीपल ऑर्गन से बनेगा ह्यूमन बॉडी. Alright, so this is what is the cell structure, of which we have to remember. As of now, I will say सारा चीज याद रखने की जरूरत नहीं है. दो चीजें आप फिलहाल याद रखिए, दो नहीं, तीन चीजें याद रखिए इसमें से. First, to remember cell. ये चीज आपको याद भी रखना है, and you have to keep this in mind to understand the rest later on, the things which I would be showing you. So this will be then it will be very easy for you to understand what I'm trying to say. So first is the cell membrane, of course. Cell membrane के बाद you have this mitochondria. These are the mitochondria, you can see. So these are the powerhouse. इनको powerhouse बोला जाता है because here the ATP production takes place. All right. Then you have the nucleus. So this is the nucleus. You can see. Now this is the nucleus. Nucleus are for they are the DNA. Okay. They give the basic structure. That is, they contain the genome, genetic material. So that is the nucleus. And then you have to remember another thing, that is the yes, lysosome. So what is lysosome? So these are enzymes which has the ability to release lysozytic enzymes. So what are those enzymes? These are those enzymes which can destroy the cells. Okay, so in the body, you normally lysozyme do not express itself. इसमें एक enzyme होता है, so that lysozyme enzyme is not expressed, because अगर वो express हो जाएगा, the cell will die. It does do that when it is required. Okay, when it has to go, when it comes near its time of death, it happens, and the lysozyme releases the enzyme, and that enzyme causes lysis of the cell. So these are the three things you remember. So one is the nucleus, there's a cell membrane, mitochondria, and the lysozyme. And another thing, इसमें आपको ये ध्यान रखना है, the cell membrane now what is the role of the cell membrane is that basically it has a very important role to play. The important role that cell membrane plays is that there is a transportation which is taking place from one cell to another, or from one cell to the extracellular space. ठीक है, तो सेल है और सेल के आजू बाजू में से अगर उसको सोच लीजिए न्यूट्रिएंट्स लेना है या ऑक्सीजन लेना है, so whatever happens it through that membrane, because that membrane is a covering which protects, which also helps in the things which as a barrier also it acts, and it helps as a filtration, like the things which are needed should be taken in, the things which are not required will be thrown out of the cell. So that is again the work of this cell membrane. And apart from that, there is a sodium potassium pump which you have to remember. So this sodium potassium pump, what it does is basically it tries to maintain the balance of what should be coming in and what should be going out. And if the sodium comes inside too much, there would be water retention, and if the potassium goes out too much, so it should not be like that. The potassium should be the sodium should not come inside too much, because if it is coming too much, then that will lead to water retention. So what should happen is that the sodium should be put out, and only the limited amount which is required should be maintained. And entire body, आपकी जो भी body structure है, God has created in such a way that it is able to maintain an equilibrium. So that equilibrium is always maintained by your body, fortunately, and that is how the body keeps yourself, or this or your entire body is kept in healthy state when it is in a state of hemostasis, that is in the state of equilibrium. All right. So now the next slide. Okay, so classification of diseases. Now we'll go to the classification of diseases, and then we'll come to the etiology of it. Now I'll tell you why, because first we need to understand, हमें सबसे पहले समझना है कि how the classification of disease have been taking place. Now homeopathic classification, you can see this is what I have given a very narrow description. Of course, the classification of diseases, what Dr. Henneman has said, I'll talk about it first, and then we'll go for the pathological classification of inflammation. So now coming to the point of homeopathic classification. Now, when I'm talking about homeopathic classification, Dr. Henneman talked about 200 years back. So his entire research was based on the sign and symptom which he saw in the patient, nothing else, because he in his time did not have this microscopes. In his time, he did not know about microbiology because there was no such germ theory. It came out quite later, after Dr. Henneman had already died. After that, this thing came up. So in his time, when he was alive, this theory had not come yet. So he was not knowing about this aspect. Whatever thing he did was purely based on his observation, his research on the patients. Now, many a times it happens when people say, was it scientific? Now, I'll before going further, I would like to say that this was very scientific. Why? I will tell you. When we talk about research, in research there are various categories of research that you can do. One of the research protocol, or one of the way of research is through experiential research. Now, what is experiential research? That is the research which is based on experience, on the accumulated action of the experiences, which is again based on your way of experiential existence, or the collection of facts. आपने जब अपने experience में जो भी collection किया facts का through your observation, that becomes a collective data, and when you based your research on that, that is known as experiential. So experiential research. His research was experiential. Of course, it was experimental. He did experiments on healthy human being by administering homeopathic medicine and seeing what are the signs and symptoms which were produced by these dynamic medicines. Of course, Dr. Henneman did that. But he was also doing a kind of research which we talk about as miasmatic study, because in that it was not practical for him to conduct any type of research based on his chronic miasm theory. In his time, he did not have such facilities to conduct such kind of a research. So whatever research was based on his experiential observation. So whatever observation, but of course the observation was very keen and very focused observation. And that's why he could arrange the right kind of data which are valid even today. Even today, those are valid. So when he was talking about classification of diseases, Dr. Henneman said there are, when he classified disease, so he first talked about indisposition. Now, what is indisposition? Indisposition means a condition. It is a slight transient alteration in the state of health. So इसको अगर समझना है तो मैं आपको समझाती हूँ. जैसे अभी जैसे 3 बजे का सेशन है और आपको यहाँ पे आना था, लेकिन अभी दोपहर को आपने खा लिया बहुत ज़्यादा. अभी खाने के बाद you are feeling very drowsy, नींद आ रही है. So you've thought of taking a mug of coffee, एकदम strong coffee. So imagine you had a lot of food in the afternoon, very heavy, and then you are having a big cup of hard coffee, strong coffee, and then you are sitting, you are drowsy, yet still you are sitting and listening to this. So what will happen? Tomorrow you might have stomach upset. So that's an indisposition which actually do not require any medication. दूसरे दिन आप कुछ मत खाइए, you will be fine, perfectly fine. So that's indisposition. So that is what Dr. Henneman talked about when he said classification of diseases. One is indisposition, where basically we do not actually need to go for any medication. A slight change in diet or regime can bring the person back to his former health. Okay, so that's indisposition. Now, second thing he talked about was surgical disease, surgery. Now, isko agar samajhna tha, I'll give you another example. Now, what is surgery? Suppose, abhi, after the COVID-19 lockdown, now this is phase 1 where the lockdown is opening. In many of the cities, might not be in every city, but in many of the cities, it is opening up. So, abhi aap ghar se nikle ho bike pe, and you follow certain protocols of the traffic police, and you do not follow certain protocols. And one of the protocols is to wear the helmet, which you don't wear, okay? And you are riding the bike and you are going. And suddenly, there is a small stone or a prick which goes inside your eye, okay? Now, suppose I am a doctor and I am a homeopathic doctor and say dynamic hair, so we will give you medicine and you will be fine. Now, this is wrong. This is something which you cannot treat like this. The stone, the small prick is inside the eyes. That needs to be removed first. Usko remove karna zaruri hai. So this is surgical disease. So that's how mechanical obstruction is there. So that mechanical obstruction has to be removed. आप उसको remove कर दो, उसके बाद आप दवाई दो for the injury that has happened to the eye. That is okay. But if the stone is still there in the eyes, no matter how much you try, that is not going to give results. Okay, so the mechanical obstruction needs to be removed first. So that is surgery. And third, he talked about the dynamic disease. Dynamic disease, and which he classified into 2 types, acute and chronic. Okay, now that he did 200 years back. Now today when we study about pathological classification of inflammation. Now what is inflammation? Inflammation is a body's response. It's a body response to the injurious agent. In very short, I'm trying to make you understand this. So your body is responding to something which is injurious. So in short, inflammation is a kind of a protective mechanism. But if it goes a little beyond, or what exaggerate ho jaye, then it can do harm. And if it is low, then it can lead to you having disease. Getting it? So that's why in pathology, again, when they're talking about the inflammatory response. Now remember one thing, Dr. Henneman's time 200 years back, they did not have that facility to understand the concept of inflammation. That was not there. Not the way we are understanding it right now. Like we are understanding inflammation, acute or chronic hoga, to hum usko kaise samajh rahe at the molecular level we are trying to understand. We are trying to understand at the level of the cells. In his time, he did not even have microscope. What he did was simply he was seeing that patient were coming. There were two categories of patient. We just saw that one type of patient were those who were having acute problems, like, and what was his observation? See, when I was doing this study of second year, when I was in second year, वो मेरे लिए बहुत interesting था. It was so intriguing for me that I thought what a genius person he was. He did not have microscope. He just through observation he understand two things, that there are two category of people coming to him. One who were having acute manifestation, meaning the phase of the disease was ODP देखा उन्होंने, onset, duration, phase. Okay, so three things he observed in two category of people. So AI or BIA. So A group of people were having the onset was very fast, duration was rapid, and then the phase was also very fast. Onset was very sudden onset. Okay, then there was another category, that was the chronic one, the people who came with diseases which was coming, the onset was very slow, gradual, the duration was long, and the phase was again very slow, and ultimately the patient would die if not treated on time. And even if the patient is left on to himself, in chronic cases the patient will definitely die. But in case of acute, there are two options, that there are two things which can happen. Either the patient will come out recovered, वो recover होके बाहर आएगा, or the second thing, he will not get recovered and he will die, because the progress is so fast that the body is unable to analyze. So this was one thing which he observed. So that was acute and chronic. So imagine that man, he did not have this any kind of microscope, kuch bhi nahi tha. He just observed, and with that he came up with acute and chronic. And today also, today when we do pathology, we study pathology, we are actually studying the two mechanisms by which the body reacts. The body gives response. One is by acute, and another is by chronic तरह से वो response देता है. So now we'll go to the next slide. Now this is the classification of chronic diseases which Dr. Henneman gave. All right, so we'll go with that classification. So Dr. Henneman said chronic diseases are of again two types. So now coming to the classification is acute and chronic. So acute में Dr. Henneman said about 5 things. One, patient might suffer from an individual acute disease. Like suppose मेरे सर्दी खांसी हो गया, influenza, flu. So that's an acute disease. Okay, but it is at an individual level. Now second, he talked about the acute individual. Then he talked about endemic. Endemic means a group of people at a small area are suffering from the same type of sign and symptoms. इसको अगर समझना है तो many a times when I teach my students, I always tell them endemic को समझना है तो if you understand goiter, okay, where there is deficiency of iodine because of which a person has goiter. So iodine की deficiency के कारण आपको goiter हुआ, कौन से जगह पे ज्यादा होगा, in which states it would be more, or which place it would be more. The places which are away from the coastal area, which is away from the sea, like in mountainous region. So those are endemic diseases. So goiter would be endemic in Himalayas. Okay, because there the food and the soil and the water will have less of iodine. So whatever the patient is eating also, still the amount of iodine required will not be sufficient. So this is endemic he talked about. So there the number of people will be suffering from the same kind of signs and symptoms, that is endemic. Epidemic, when like a little larger area is involved, where a number of people are suffering from same sign and symptoms. And for that, you now, as you understand, we are going to have monsoon. Abhi monsoon aa gaya hai 1st June se. There was prediction that monsoon are on its way, and there's going to be a cyclone in Jamnagar, towards Jamnagar, and Nisarg cyclone towards Mumbai and all. So you know this with this, हमें पता है there are few diseases which becomes very prominent during this time. Monsoon के समय में कुछ diseases बहुत prominent हो जाते हैं. What are those diseases? These are basically क्योंकि इस समय मच्छर ज़्यादा हो जाते हैं, and because of that you might have malaria, you might have dengue, very common. All right. So, and then typhoid is also very common because the water get contaminated. So these are the things which happens. All right. So that's epidemic. Then pandemic. A pandemic, I don't think so I need to go into detail of it, because right now all of us know what is a pandemic, where a number of people suffering from same type of signs and symptoms exhibited throughout the world, okay, at the same time. So that is pandemic. So you can see that is COVID-19 that is happening. And the last one, so if you understand sporadic. Now sporadic is like few people here and there throughout the world are suffering from some problem. So for example, malaria, abhi agar mujhe ho gaya, now this is probably not the right time, monsoon ke samay hona chahiye, and that is a sporadic. So I had malaria right now. Someone has dengue at the time of winters or in the month of summers. So those are sporadic. So for sporadic onset of some acute disease condition, that's sporadic. So these are the classification which Dr. Henneman gave about acute diseases. So what was individual, sporadic, then you have epidemic, endemic, pandemic. All right. So these are the classifications which he gave. Then he talked about chronic diseases, and in chronic diseases, he talked about two types of chronic diseases. One, the disease with few symptoms, and second was he was talking about diseases with fully developed symptoms. Now, diseases with few symptoms, he categorized जो थोड़े symptoms होते हैं उसको उन्होंने categorize किया in two types. So one was this. One was the one-sided diseases, which could be one-sided, meaning या फिर आपको physical problem है या आपको mental problem है. For example, schizophrenic. So schizophrenic patient को physically, normally it has been seen that schizophrenic patient do not have any problem with their body. They are very resistant to small types of acute diseases. It's if you think I'm not stating the facts, it's a fact. You should visit some psychiatric wards and units, and you should go and interact with their doctors. You will come to understand that it is very uncommon for the person who are suffering from mental diseases, especially the ones who are suffering from schizophrenia. They do not actually suffer from any physical symptoms. Okay, so those are one-sided diseases. Okay, and Dr. Henneman in his time could observe that. And another one was the physical disease. So there are certain physical diseases which are there in the body, but with that there is no mental problems as such. Only physical problem is there, but nothing related to the mind. So mind is not affected, but the body is affected. And then he talked about local maladies. And in local maladies, he talked about two types. One is the surgical, where you need to go for surgeries, because there is one particular organ where there is some swelling, and that needs to be removed because nothing, and that is external. That is because of some external cause. So it is not from within the body, because it is, if the cause is from inside the body, then it needs to be treated from inside. But if it is from the outside, from some external cause, then that needs to be removed. Usko humko remove karna hai, so that he called as the surgical diseases and non-surgical diseases. So in non-surgical diseases are those diseases where we actually do not require surgery. और इसको अगर समझना है तो बेस्ट एग्जाम्पल, और कुछ नहीं याद रहना है तो टॉन्सिलाइटिस आप याद रखिए. सो दिस इज अ वेरी कॉमन थिंग विच यू सी इन चिल्ड्रन. बेसिकली एडोलेसेंस को और बच्चों में ज़्यादा होता है. टॉन्सिल्स दे गेट इन्फ्लेम्ड, and the allopathic mode of treatment is that we go for antibiotics if the patient does not respond well to antibiotics, and repeatedly if there is a reaction and repeatedly tonsils hote hai, then they go for surgical removal of the tonsils. But basically this is not required. All right, this can be treated with homeopathic medicine, because it's a way the body is trying to develop their immunity. If the immunity can be developed well, it can be brought to a position where it can fight all these external influences, then you need not actually go for a surgery. But here, in this case, in most of this certain cases, we do really go for surgery, like in tonsillitis. Now, disease with fully developed symptoms. So in disease with fully developed symptoms, they were again categorized into two types. One was non-miasmatic, another one was miasmatic. So in miasmatic, we have the single and the compound, where we will talk about the miasm like sora, psychosis, and syphilis. Okay? And non-miasmatic mein, he talked about three things. Now, this was again very interesting to understand. When we try to understand pathology, you will see many a times they also talk about this. Okay? So non-miasmatic disease, there are many diseases which are basically drug-induced. Now, what is the terminology that we use today? आज के टाइम पे what is the terminology we are using for drug induced diseases? Those are known as iatrogenic. Okay, so iatrogenic diseases are any disease which are produced because of the drugs which we are taking in. Okay, so that he observed in his time. Then occupational hazard. So we already know there is an entire allied subject for that, different department where doctors and are trained for this occupational hazards. So the people, there are many people, because they are working in a certain environment, that is the reason why they are suffering from certain type of disease. Okay, so a certain kind of disorder. So that is occupational disorder. And the other one is that pseudochronic. Now in pseudochronic diseases are those diseases wherein basically there's the chronicity is because the patient is living in a condition which is maintaining the disease. Okay, suppose if I am having arthritis, and that arthritis is always aggravated in a damp condition and still I am staying there, so that will lead to pseudochronic disease. So I am basically, because I'm staying in that condition, in spite of me taking all kind of disease, all kind of medicine, it will not get better because that is being aggravated by that condition in which I'm staying. So that is pseudochronic. Probably if I'm out of that place, मैं वहाँ से निकल जाऊँगी, so I will not have any problem. I would be back to my health. Okay, so these are the different types of chronic and diseases which Dr. Henneman talked about. Now, when we talk about inflammation, so inflammation, we talk about the two things, acute and chronic. And acute, we always talk about the 5 cardinal signs: rubor, tumor, calor, dolor, and loss of function. So what is that? So there would be like 5 signs. There would be congestion, that is the redness. Then there was swelling, that is tumor. Color, that is heat produced because of the congestion. Then there would be dolor, meaning pain would be there, and loss of function, where because of this inflammatory reaction, the patient will be unable to do functioning. So these are the 5 cardinal signs of inflammation. Okay. Now, Dr. Henneman said that, now this is about the pathological understanding of acute inflammation. Now, Dr. Henneman said that when we are talking about acute diseases, the acute diseases are always caused due to the exciting causes which actually excites the latent sora. So the latent sora, when that is being exposed to the exciting causes, which remains basically dormant, हमारे body में वो dormant रहता है, but the moment some exciting cause is there, that leads to it becoming active, and then you have the acute sign and symptom and disease. This is what he said. So I want you to remember this one thing first. Now then, coming to the point of chronic. Now chronic disease, when we are talking about chronic disease, in chronic disease there is granuloma formation. So granuloma formation, in chronic disease, if you read the pathology book, Harsh Mohan ki, if you read that book, in that Harsh Mohan, he has written, what are the etiological factors, or what is the factors which are responsible for causing a chronic disease? There could be many factors, but 3 things they have written. Okay, so first is the chronic disease is de novo, meaning it is a new disease which is chronic from the beginning. For example, tuberculosis. Tuberculosis is a chronic disease which is because of the infection from the tubercular bacteria, and that is from the beginning it is chronic. Then after that, there is also 2 other types of chronic diseases that can occur. One, if there is recurrent acute inflammation. So if there is recurrent inflammation, अगर आपको बार-बार acute problems हो रहे हैं, then there would be a stage where this acute will become something chronic, because your body is unable to deal with it. The body will try to convert it into something which is slow in progress, because jaldi progress hoga, so the body will die. So your main instinct, see, the body has a basic instinct of survival, and your entire body, entire cell, the DNA of our cells consist of that information. That is the information which is of the survival. So there is an instinct to survive, and your body tries to do whatever things it has at its disposal to keep it alive. All right. So if you are having repeatedly infection, आपको बार बार recurrent infection होता है, then that infection is gradually converted into something which is slow in progress, which is chronic. So होगा, damage तो होगा, but the progress will be slow. At least you would be able to survive. Mortality नहीं होगी, morbidity हो जाएगी. Are you able to understand that? Mortality means you will die, but morbidity meaning you will be surviving, but not with the sufficient kind of activity, but yet you will be alive, because the basic instinct which every DNA consists in our body, each cell consists is the survival. All right. So that is there. And then there are certain acute diseases that acute diseases can get converted into chronic. So there is one conversion from acute to chronic. So that can happen when the body is unable to deal with that infection. So then that acute infection goes into the chronic one. So that's why you will always hear many a times doctors saying this कि आपको सर्दी खांसी कितने दिन से है. अगर 3 महीने तक चलता रहा, सर्दी खांसी 15 दिन तक रहता है, ठीक है, but if it is lasting more than 3 months, then it is getting converted into something which is chronic in nature. Okay, वैसे ही अगर आपको insomnia है, insomnia meaning you are not sleeping well, so if it is remaining for a few hours, it is okay. I mean for a few months, till it is few months, it is okay. 3 months ठीक है, 3 months के ऊपर गया, anyways if you can't sleep for 3 months, you will not be able to survive also that in a very conscious way. So if you go beyond that, if you are not able to sleep properly, so then it is going into something chronic. Okay, so that turns into something chronic. So those are the 3 things which you see, which you read in pathology books. They talk about the 3 things that chronic inflammation can happen because of 3 things. And when we talk about Hahnemanian concept, Hahnemann also said the same when it comes to the understanding of chronic diseases. He said that when the body is, when we talk about SORA, psychosis, or syphilis, when we are treating this, because SORA, he was talking about the disease which was related to the leprosy he was talking about. So when there is some itch or the skin infection, he was actually talking about the skin infection. He said that if there is a skin infection, and if that is not treated well, and if it goes inside, and the body then converts it into something chronic. So you see, even today that is valid. Okay. So if you are not able to treat, if the body is not able to cope up with that condition, with something which is acute, then it turns into something chronic. And that is what Dr. Hahnemann also said in his time, that if the body is unable to deal with this infection, skin infection, then gradually it can develop into something which is chronic in nature. So that's why SORA developed over a period of time. It develops because the skin infection which was there, that was the itch. He's talked about that itch. And then he said that itch was not treated well. It was treated with some suppressive ointment or something. And then it went inside, meaning internalization of the disease occur. And then that caused more problem for the patient. So that became a chronic miasm. So that's the understanding which he had from his time. Now, for causes of the disease, so etiology. Now coming back to the etiology. So etiology in homeopathy we need to remember 3 types of causes. And in cell injury, when we are talking about cell, because we are talking about pathology, so pathology में हम हमेशा cell के बारे में बात करते हैं. So when we are talking about the cell injury, there are 2 types of. One is the genetic cause, another is the acquired cause. And when we talking about disease, the causes of the disease in homeopathic perspective, अब देखिए दो तरह से लिखा है मैंने. One is the homeopathic perspective. This is the etiology, that is the cause of the disease. That is, the cause of the disease could be exciting cause, and the maintaining cause, and the fundamental cause. Okay, exciting cause meaning anything which can affect us. Now, exciting cause क्या है? I will show you later. Then maintaining cause, like there is something which is remaining and which is obstructing the cure. Okay, so like for example, मैंने आपको बताया कि if you are staying in a occupational hazard, so occupational hazardous disease are those diseases which is because of the occupation. So whatever occupation you are doing, अगर आप एक factory के company में जाते हो और उस factory में there is certain chemicals which irritates your skin, तो जब तक आप वहाँ पे उस company में उस जगह पे काम करोगे, this thing is not going to get treated. All right, so that is maintaining cause. Then comes the fundamental cause. So when we are talking about the fundamental cause, we are talking about the miasm, which we was talking about. So miasm, these are sora, psychosis, and syphilis, which actually makes a person have the disease, chronic disease condition. So he was talking about those fundamental causes. And when we are talking about the exciting causes are like the materia peccans. It could be the telluric cause, the meteoric cause. So meteoric cause are the environmental factors. Okay, so the environment can affect, the climate can affect. So those effect can lead to us having a disease condition. For example, there is जब weather change होता है तो आपको पता है कि सर्दी खांसी होती है. So that's an exciting cause. Okay. Now when we talk about pathology in general, in pathology they talk about two types of causes. One is the genetic cause, another is the acquired causes. Okay. So the acquired causes are physical agent, psychological agent, chemical, microbes, immunological agents, nutrition, hypoxia, ischemia. Now, you can understand it very well that these are something from the outside. You are not born with these things. Okay. Physical agent, like something like heat. Loo lag jata hai, so you know what happens. You have dehydration, you can have heat stroke also, and people can die. So this is a physical agent. So you don't have control over these things. These are something external. Okay, so these are acquired causes. Then you have psychological agents. Psychological agents could be your stress, your work environment where you're working, your relationship. So these are, and or probably your perception towards life could be also responsible. Sab kuch acha chal raha, but your perception is not right. Then also psychological agents that could also lead to stress. Chemicals, अगर आप बहुत ज़्यादा chemicals के लिए one example I can give is that if you use too much of makeup and then you have skin rashes, so that's chemical. You need to stop using those. तो अगर आप chemical use कर रहे हो और आपके छोटे छोटे दाने आ रहे हैं, I remember one of my friend, she used to use this Fair and Lovely. The Fair and Lovely use करने के कारण she used to have small and she used to look a little fair. I don't know what fair, but yeah, for her it was fair. But after some time when she stopped using Fair and Lovely, तो उसको छोटे छोटे दाने आने लगे face पे. ठीक है? Now that was a small eruptions, very small eruption. उस समय समझ में नहीं आया, but it was a reaction to the chemicals which she was using, and that chemical was nothing but the Fair and Lovely ointment which she was using. So when you are using certain chemicals on your body, that can also cause disease. Microbes, of course, microbes, it could be your bacteria, viruses, parasites. Those are microbes. Immunological. So when we are talking about immunological, we are basically talking about your body's reaction. Your body's reaction meaning your immunity. If your immunity is too much, meaning exaggerated reaction, तो आपको एलर्जी हो जाएगा. अगर फॉर एग्जाम्पल आपके एग्जाम्पल के लिए देर आर सर्टन पीपल हु आर एलर्जिक टू स्प्रे और सेंट. उनको अगर थोड़ी भी हल्की सी अगरबत्ती की खुशबू आती है, दे स्टार्ट स्नीजिंग. Now basically immunological agents help us to have a defense mechanism, but here सिर्फ अगरबत्ती की खुशबू से it is becoming because your body is giving excessive reaction. थोड़ा is okay, थोड़ा सा एक बार चीखते हो fine, but if you continuously keep on sneezing and every time it happens you do that, then it is immunological. Then we have nutritional. Nutritional means if you are deprived of food or if you are overeating, and that leads to obesity. अगर आप बहुत खा के मोटे हो जाते हो या फिर आप बिल्कुल कुछ नहीं खाते हो और पतले हो जाते हो या starving करते हो, then again you will have disease. You are going to have disease. Hypoxia and ischemia, these are those conditions in which the supply of oxygen and the supply of blood is hampered, and because of which you are having problem. Okay, so now microbes. All right. Now one thing I would like to say, just read, and I want all of you to know this. If you read that Dr. Henneman in his article. Now, many a times people ask me this. I have seen people asking me this, especially my some patients and some people asking me, do you really treat infection like bacteria, viruses को आप treat करते हो? See, that's a different question to answer. But the first question they have is, do you really believe that these agents causes disease? Now, one thing. There is a little misunderstanding in our community. The problem is that we really understand that how this microbes get into our body and they cause disease. That's a fact. It's not like it doesn't. But there are certain factors which needs to be understand also. Only getting the microbes inside the body will not cause a disease. COVID-19 का अगर वायरस आपकी बॉडी में आ जाएगा, if you are found to be positive, doesn't mean that you will have the sign and symptoms. Sometimes you might remain asymptomatic also. Okay, and you might be just a carrier. You will not show any sign and symptoms, nothing, and you will be perfectly fine. And on the other hand, there could be a person who will get this virus inside his body and he will start showing all the signs and symptoms. So these are two different things. They are two different aspects. We need to understand this. All right. So yes, do we understand that microbes are responsible? As homeopaths, we really understand that they are responsible, but they are not the sole responsible thing. There are other aspects which needs to be there. Only then this microbe will have the ability to cause a disease. Okay. And if you read Dr. Henneman in his article, which was published by the name of Friends of Health in volume 1 and 2 in 1792. And so in 1792, he has given a detailed description of how to avoid the infection and contagion of cholera. And that if you read that, it's very interesting. I'm telling you, like something you will feel. Dr. Henneman was also the first who said described about the microbes. If you read in his article, which is written in 1831 on the cause and prevention of Asiatic cholera, this article was written in 1831. Please understand, that time there was no germ theory. Germs से आपको problem होती है, that was not discovered. There was no microscope till his time, this time. So in 1831, he is writing, see, remember, this is what he has written. Those excessively minute, invisible living creatures, so inimical to human life, of which the contagion matter of the cholera most probably consists millions of those miasmatic animated beings. See, if you read that thing, animated beings, he is somewhere signifying that Sarah's minute. And then if you read this word, minute, invisible, I don't know, and creatures, if this is not something which is telling about microbes, I do not know what else, So you can see, which consist of millions of animated beings. So if you read Dr. Henneman's literature, you will come to understand he was a gem of a person and his observation skills were fabulous. Like what we could not think right now, he could think then. Okay, and then about chronic diseases. So this is the chronic disease where with the chronic diseases are because of the different factors, if you understand. So when we are talking about acute diseases we talk about microbes se hota hai, bacteria, viruses. Yes, understood. It happens because of bacteria and viruses. But the bacteria and viruses are not the sole responsible thing. अगर आपको इसको दूसरी तरह से समझना है, आप समझ लो अभी मॉनसून का सीजन आएगा. Not every one of us will be suffering from malaria. अगर मच्छर काटने से सबको मलेरिया होना था, अगर मच्छर काटने से ही सबको मलेरिया होता, so every one of us would be suffering from malaria. See, it depends to many things, depends on it. What are the things on which it depends is first of all, you need to understand that how much is the virulence, meaning जब the bacteria or the virus आपकी body में जा रहा है, so is it producing any kind of endotoxin or exotoxin or enzymes which are in excess, और उसका जो load है, जो body के अंदर जितने germs गए हैं, वो अगर उसका load ज़्यादा है, if the virulence load is more, then only you will suffer. Or else you will not suffer. Your body has the mechanism to deal with such organisms. It can fight it out. It can, because I told you, DNA में हमारे हर एक DNA में इतना है, every cell wants to survive. So because of that instinct of surviving, it will try its best to make itself survive in that condition. So microbes coming and getting disease, no. It's not like that. The microbes has to come inside, then your body. और इसको मैं आपको एक और तरीके से समझाती हूँ. माइक्रोब्स जब आप नाक के अंदर से जाता है, सपोज आप इन्फ्लुएंजा वायरस का ले लेते हैं, तो ये दिस वायरस गेट्स इनटू योर नोज. Okay, now forget about the virus also. Let's say a small dust particle that goes into the nose. So जैसे nose के अंदर जाएगा, the nose has what they have this protective mechanism which is the hair, nose hair. वो पहले उसको तो रोकेगा. Still if it cannot, it goes inside तो अंदर हमारे towards the pharynx, larynx ये सब. So we have this mucus in the lungs also, we have mucus, and so these mucus will again hold it and throw it out in the form of cough reflex. Coughing होगी आपको तो cough के साथ वो निकल जाएगा. Still if it goes inside your body, still if it gets inside the lungs, then what is the thing which can happen is that now your न्यूट्रोफिल्स, द फर्स्ट लाइन ऑफ डिफेंस आर द न्यूट्रोफिल्स, जिसको हम बोलते हैं पहला जो सबसे पहले आते हैं लड़ने के लिए वो न्यूट्रोफिल्स होते हैं. सो द न्यूट्रोफिल्स विल कम. देन इफ उनसे भी काम नहीं होगा, देन द मैक्रोफेजेस, मोनोसाइट्स, टी सेल्स, बी सेल्स. सो देयर आर सो मेनी थिंग्स, यू नो. So body is trying to take care of it. It's not like it enters and it can happen. No, your body can only react depends on how much it is going. What is the incubation period? If the incubation period is fast, so you will have the disease faster. If the incubation period is long, you will take longer time for the disease to, manifest itself. So there are so many factors which determines whether you will have a disease or not. It's not just the microbes itself. अगर वही होता तो एंटीबायोटिक से आज तक हमने सब डिसीज खत्म कर दिए होते. बट इट इज नॉट पॉसिबल. यू कैन सी दैट द एंटीबायोटिक मे बी रेजिस्टेंट आने लगे. There are newer strain which are coming. Corona is also not new. It was already present now, but this strain is new. This virus is new. COVID-19 is new, but it belongs to a family which was already there in the planet. वो था ही. Okay. Now coming to the point of chronic disease. Now that was about acute. Now coming to the chronic diseases. In chronic diseases, the problems are from sedentary life, from perceived stress, from pollution, from metabolic overload, from iatrogenic medicine, iatrogenic. So you see, these are the causes which could lead to you having chronic disease. Now this is the pathological understanding. This is the pathological understanding. But when we are talking about Hahnemannian concept of chronic disease, we also talked about the two things. One was the disease with few symptoms, the disease with fully developed symptoms. Fully developed maybe आपने उसमें पढ़ा कि there are again of two types, the miasmatic and non-miasmatic. And non-miasmatic में there were few that occupational diseases, okay, iatrogenic disease. So you can see the iatrogenic med overdose. So these are the reason which could do. So in short, if you see, Dr. Hahnemann was trying to, what I understand was that Dr. Hahnemann was trying to understand the progress and the way disease occur. In short, he was trying to understand the pathogenesis. But only tool he had was with him during his time was patient and the disease condition, nothing else. Probably if he had something more, he could have done. Now, one thing in pathology, we talked about the acquired causes and the genetic cause. Now, in genetic cause, developmental defect, if you read, I've just taken three things here. Developmental defect happens due to tetrogens and susceptibility. Now, what is tetrogens? It is the way the body will react to certain agent from the environment. Okay, so developmental defect will not only occur just like that. ऐसा नहीं है कि ऐसे ही हो जाता है. There has to be presence of this tetrogens which will influence whether you will have a defect or not. अच्छा, तो इसको समझाने के लिए I will tell you, and that again depends upon the susceptibility of that individual. Now, for example, अगर आपने सुना होगा कि when a woman is pregnant, उसको हम दवाइयाँ नहीं देते ज़्यादा. क्यों? क्योंकि chemicals, if वो बहुत ज़्यादा आपकी बॉडी में जाएगा, they can do damage to the cell of the embryo. तो जो embryo जो आपके पेट के अंदर जो बच्चा हो रहा है, उसको वो damage कर सकता है, right? So now it again depends upon patient to patient. Some patient might show a very adverse reaction, and certain patient might not show any reaction at all. So that again is dependent, and that depends upon susceptibility, right? Now, developmental defects, I'll tell you one example, ये genetic cause का. When I was doing this study, one thing strike me. In my family, मेरे family में ही, I have my own Masi, cousin Mausi हमारी. So she, there are two sisters, okay, but both of them are monozygotic twins, meaning एक ही जैसे दिखते हैं, identical twins they are, ठीक है, दोनों को देखने में भी same, सब कुछ same, they look the same. So you cannot actually understand which is कौन सी मासी A है और कौन सी मासी B है. So they look very similar. So even हम जब छोटे थे तो I couldn't even recognize those aspects. But the problem it was that right now, one of my masi is no more. She's no more. But the other masi is surviving and she is fit. But one of the masi, she developed some type of ulceration in her stomach, and later that ulceration turned carcinogenic and she died. If you understand, the basic genetic composition of both this person are the same, क्योंकि दोनों एक ही zygotic ट्विंस है, मोनोजाइगोटिक ट्विंस है, तो नॉर्मली हमारा जो अंडरस्टैंडिंग ऑफ जेनेटिक है, दैट इज दे आर मेड अप ऑफ द सेम टाइप ऑफ जेनेटिक मटेरियल. So normally they look the same, they are the same. But why this? Why that one of my masi died quite young? Actually, she died at the age of 50, and the other masi, by God's grace, she is alive and she is not having that problem. But हमारी फैमिली में we started having that doubts because हमको ये था कि उनका हुआ है तो इनको ना हो, because there is some correlation. But fortunately, it's been now 10 years, nothing has happened to my masi. So if you understand, there is a role of susceptibility. Now, what is susceptibility? It is the way your body reacts to a stimuli. So your susceptibility is the way your body reacts to a stimuli. तो कुछ भी, अब वो stimuli क्या हो सकता है? It could be something from outside, like stress, could be some environmental factors, could be your age, could be the way your constitution, मतलब आपका शारीरिक बनावट, your mental makeup, आप किस तरह से सोचते हो वो, could be because of the drugs which you have been taken that can influence your susceptibility, the way your body will react to a stimuli. Okay, so that is how normally in healthy condition में suppose धूल मिट्टी आती है तो मुझे थोड़ा सा एक छींक आएगा, that is a stimuli. So suppose मैंने ऐसे किया, now what happened when I do this, आप सब एकदम से ऐसे हो गए, startle हो गए, what she did. So this is a stimuli. So when I am doing some action, that is creating a response from your side, right? Similarly, when you are in a normal state क्या होता है, your way of reaction will be totally perfect. But in an abnormal state, this will be, two things will happen. Either you will be exaggerated, बहुत ज़्यादा, या फिर very low. Okay, so exaggerated reaction like allergies, and very low reaction meaning low susceptibility, and that's why you will have low. Therefore there will be more chances of you having infections and recurrent acute diseases, etc. So there are two types of abnormal reactivity which can happen. One is excessive, another is hypo. Okay, so need to understand this susceptibility also. And if you see, susceptibility is also very valid as far as pathology is concerned. Even in pathological subjects, we really understand this terminology, susceptibility. Okay, so these are the different factors which are responsible. Now, this is how the modern pathology or the modern biopsychosocial model of disease talks about. Like, how will my body react to a agent from outside? मुझे disease होगा कि नहीं? This will be a congregation of all this factor, psychological, biological, and social. इसीलिए पहले, when in Dr. Henneman's time, there was only one aspect which was understood. Body and mind was considered to be two different things. They did not understand that they are the same part, and body was understood as a robot, as a machine. But now the concept of medicine has changed from a biological model. It is now more of a biopsychosocial model, where we are trying to understand why the disease happened because of the biological aspect, the psychological, and the social aspect, which influences the person's susceptibility, the way the patient will react to a stimuli. And that is how, if it is a normal reaction, the patient will be healthy. If the reaction is a little more, then abnormal reaction. If the reaction is less, then also abnormal reaction. And abnormal reaction, and that will lead to abnormal meaning abnormality meaning मतलब disease. Okay. Now, pathogenesis of cell injury. Now, this is very interesting because now this will help us to understand miasm, psora, psychosis, and syphilis को समझने में this will help us. Pathogenesis of cell injury में they say that the type, duration, and the severity of the injurious agent matters. So whether a cell will get affected, that is what I was telling you, that आपको infection होगा कि नहीं, that depends upon the type, the duration, and the severity of the injurious agent. Now, इसको समझने के लिए, for example, for that you need to understand three things. In our body, आपको थोड़ा सा physiology भी समझना पड़ेगा. In our body, we have three things. Okay, so one is the liable cells, the permanent cells, and the stable cells. ठीक है. Now, what is liable cell? Liable cells मतलब ये पूरी जिंदगी they keep on proliferating, मतलब ये बनते रहते हैं. जैसे हमारी skin है. Every 3 months you have new skin. हमारे हेयर है. So you know there are new cells which are epithelial cells है, मुंह वाले cells and all. So they every 3 months you have new cells coming up. Then there are cells which are not stable cell, जिसमें ability has decreased, तो proliferate की ability कम हो गई है, but अगर जरूरत पड़ी तो they can proliferate. For example, liver, kidney, इनमें ऐसा है कि अगर जरूरत पड़ेगी तो they will start regenerating, but as such they are stable. ठीक है, रोज रोज नहीं बनता है लिवर सेल, रोज रोज किडनी नहीं होगा तो फिर तो 4-5 किडनी हो जाएगी, ऐसा रोज रोज नहीं होता है. ठीक है. एंड देन देयर इज परमानेंट सेल्स लाइक द सीएनएस, लाइक द कार्डियक सेल्स. इसलिए आप देखिएगा व्हेन वी आर टॉकिंग अबाउट सिवियरिटी मतलब अगर कार्डियक अफेक्शन होता है तो हम चुपचाप नहीं बैठते, वी टेक द पेशेंट डायरेक्टली टू द हॉस्पिटल. चेस्ट में पेन आता है तो वी टेक द पेशेंट टू द हॉस्पिटल. व्हाई? बिकॉज दीज आर द सेल्स, दे आर कार्डियक सेल्स. वो एक बार बनता है, डैमेज हो गया, नेक्रोसिस हो गया. नेक्रोसिस मीनिंग इन पैथोलॉजी व्हेन वी टॉक अबाउट नेक्रोसिस इट मीनिंग सेल डेथ. एक बार हो गया मतलब वी कैन नॉट डू एनीथिंग. सो दीज द टाइप, व्हाट इज द टाइप ऑफ द सेल व्हिच इज बीइंग अफेक्टेड, व्हाट इज द ड्यूरेशन, कब तक वो ड्यूरेशन है. अगर मैं हीट स्ट्रोक कब आएगा, ऐसा नहीं है कि धूप है तो हीट स्ट्रोक आ जाएगा, नहीं. अगर आप बाहर गए हो 1 घंटे 2 घंटे 3 घंटे से आप बाहर हो, आप खेत में काम कर रहे हो, आपने पानी नहीं पिया, इफ यू आर अ फार्मर, there are high chances that you might die from a stroke because of the heat wave. That the heat has to be also much. ऐसा नहीं कि 30 डिग्री के में मर सकते हो, depends, लेकिन नहीं मरोगे. Normally if the heat wave occurs when the temperature is more than 42, 43, 45 का temperature चल रहा है, you are working in the outs, आप फिर खेत में काम कर रहे हो 2-3 घंटे तक without hydrating yourself, there is a chance that you might die. So that is the duration and severity. कितना severe है. ओके, सो सिवियरिटी कितनी है. आप 3 घंटे से खड़े हो, आप एकदम डिहाइड्रेट हो गए हो, अगर आपका ब्लड लॉस हुआ है, सपोज आप एक्सीडेंट में गए हो एंड देयर इज एन एक्सीडेंट व्हिच हैज हैपेंड, आप रोड में गए हो, एक्सीडेंट हो गया, ब्लड लॉस 5 लीटर ब्लड होता है बॉडी में. अगर आपका ब्लड लॉस ज्यादा हो गया, ठीक है, एंड इफ यू आर नॉट अटेंडेड इमीडिएटली देन यू माइट डाई. बट अगर आपका ब्लड लॉस थोड़ा सा हुआ है देन वी कैन टेक केयर. But blood loss बहुत ज़्यादा हो गया है, that's a severity. So these are the 3 things on which your body, how will your body respond, how will your body show the disease depends. And in pathology we always talk about normal cells has 3 types of reaction. Adaptation, ये adaptation समझ लीजिएगा, बहुत आसान, बहुत अच्छा है, क्योंकि adaptation समझ में आएगा तो सोरा, साइकोसिस और सिफिलिस समझना बहुत आसान हो जाएगा. Reversible cell injury, irreversible cell injury. ठीक है. रिवर्सिबल सेल इंजरी में द सेल इज हैविंग सम अनऑक्सिजियस एजेंट, बाहर से कुछ आ रहा है, डैमेज हो रहा है, बट बॉडी इज स्टिल ट्राइंग टू कोप अप विद दैट, राइट. रिवर्सिबल. इरिवर्सिबल में देयर इज 2 थिंग्स दैट हैपन. देयर आर 2 थिंग्स इरिवर्सिबल में होता है. वन, देयर इज डैमेज टू द माइटोकॉन्ड्रिया एंड द माइटोकॉन्ड्रिया कैन नॉट वर्क टू प्रोड्यूस ATP. मैंने आपको पहले ही बताया था, सेल का मेन जो रोल है वो माइटोकॉन्ड्रिया का है. माइटोकॉन्ड्रिया इज नॉट एबल टू प्रोड्यूस एनर्जी, आपका सेल काम नहीं कर पाएगा. तो ये ही नहीं हो रहा है, ठीक है. एंड दूसरा, आपके सेल मेम्ब्रेन हैज गॉट डैमेज्ड, और वो डैमेज को हम ठीक नहीं कर पाएंगे. एक बार डैमेज हो गया मेम्ब्रेन, सेल मेम्ब्रेन, सो मतलब सोडियम पोटेशियम का पंप एकदम बिगड़ गया, नथिंग कैन बी डन. रिवर्सिबल में देयर इज स्लाइट चेंज इन द माइटोकॉन्ड्रिया, स्वेलिंग हुई है माइटोकॉन्ड्रिया में, डैमेज नहीं हुआ है, थोड़ा सा डैमेज आया है सेल मेम्ब्रेन में, पूरी तरह से नहीं हुआ है. सो स्टिल देयर इज टाइम, अगर आप थोड़ा सा उसमें, इफ यू कैन रिमूव दैट सेल फ्रॉम दैट area, the cell will come back to its normal state. Adaptation is that when there is a situation where the cell is trying to adapt so that it can survive. Okay, क्योंकि मैंने आपको बताया हर DNA, आप ये हमेशा ध्यान रखिए that every cell of your body is trying to be alive. So when you're trying to be alive, normal cells, so they will try to adapt itself. ठीक है, अगर आपको खाना नहीं मिल रहा है, so what will happen? You will not die immediately, right? First you will start shrinking in your size. तो muscle wasting हो जाएगी. So that is atrophy. You know, your muscles are shrinking in size. All right. Hypertrophy. Suppose आपको hypertrophy के लिए जैसे जब कार्डियक मसल्स में बहुत प्रेशर पड़ता है तो सबसे पहले कार्डियक फेलियर होता है, ऐसा नहीं है. सबसे पहले कार्डियोमेगाली होता है. The heart increases in size. There is thickness of the cardiac wall, ventriculus. First that happens. That is compensatory mechanism. The compensation is happening because the body is trying to survive. Okay, so that is adaptation, hypertrophy. So these are the adaptive processes, and sometimes it can also change itself to a certain other cell just to be alive, like metaplasia, dysplasia, but that is a deviation. Now reversible cell injury mein, you have to just remember these three things. First, decrease ATP. Okay, decrease ATP के कारण क्या हुआ? मैंने आपको बताया था ATP प्रोडक्शन कब होता है? जब आपकी बॉडी में ऑक्सीजन सप्लाई है. ऑक्सीजन कहाँ से आता है? ब्लड के साथ. सो इफ द ब्लड इज कैरिंग ऑक्सीजन एंड इट इज कमिंग टू द सेल, नाउ इट हैज स्टॉप्ड. ना तो ब्लड आ रहा है, इस्चेमिया मतलब ब्लड अभी आ नहीं पा रहा है. सो देयर इज स्टॉपेज ऑफ द ब्लड एंड ऑक्सीजन. सो जब where there is a stoppage, now what will happen? Oxidation will not happen, क्योंकि ऑक्सीजन है ही नहीं. तो ऑक्सीजन नहीं है तो एटीपी कैसे बनाएगा? So the body will go into another mode that is known as anaerobic respiration. So anaerobic phosphorylation भी बोलते हैं उसको. So now it will go into that. Now इसमें क्या होगा? Now the body will start producing ATP. But मैंने आपको पहले ही बोला है, बहुत ज्यादा अगर आप anaerobic respiration करोगे, आपकी बॉडी करेगी, there would be accumulation of lactic acid. Excessive accumulation of lactic acid. Excessive accumulation of lactic acid will decrease the pH of the blood. pH of the blood or pH of the cell. pH of the cell goes down. The moment it will come down, now the sodium potassium pump of the cell membrane will get damaged. And because it will get damaged, now the sodium will start coming in, the potassium will start going out. So ulta ho jayega everything. Then there will be more of calcium inside the cell. Very important thing I will tell you, that there is a role of calcium here. And then there would be detachment of the ribosomes. So what are the detachment? What is the ribosomes? What are the ribosomes? Ribosomes are basically for the production of protein in the cells. Protein की जरूरत है, आपको पता है, बॉडी में प्रोटीन, फैट, कार्बोहाइड्रेट्स, इन सब की जरूरत होती है. अगर डिटैच हो गया ribosomes, so what happens that your protein production will go down, your ATP is down, your sodium potassium pump is not working. It is not working, it is working insufficiently. So this is known as reversible cell injury. यहाँ तक सेल के पास अभी भी चांस है कि अगर अभी तक माइटोकॉन्ड्रिया, मैंने आपको बोला इरिवर्सिबल में दो ही चीज ध्यान रखनी है. इरिवर्सिबल सेल इंजरी में दो चीज होना चाहिए. एक, माइटोकॉन्ड्रिया का डैमेज होना चाहिए, अभी तक नहीं हुआ है. मैंने यहाँ पे आपको एक बार भी नहीं बोला कि माइटोकॉन्ड्रिया का डैमेज हुआ है. सेकेंड, सेल मेम्ब्रेन का डैमेज होना चाहिए. अगर ये सेल मेम्ब्रेन डैमेज हो गया और माइटोकॉन्ड्रिया डैमेज हो गया, मतलब इसके आगे कुछ नहीं हो सकता. ठीक है, आप उसको रिवर्सिबल नहीं बना सकते. अब खत्म हो गया है तो सेल, द सेल विल डाई. रिवर्सिबल में देयर इज स्टिल चांस. यहाँ पे अगर इफ यू सप्लाई अगेन ऑक्सीजन एंड ब्लड, द सेल कैन कम बैक टू इट्स नॉर्मल प्रोसेस. ओके, सो दिस इज द फर्स्ट थिंग. Okay, now Dr. Henneman talks about SORA, psychosis and syphilis. Now I'll ask you to remember this. Decrease ATP याद रखिएगा. So decrease ATP means decrease energy production. Okay, ये ध्यान रखिएगा. Now we'll go to the second slide. Okay, so prolonged, like decrease ATP. Decrease ATP के बाद what happens? There is increased. Now that was अगर ischemia थोड़ा सा रहा तो, लेकिन अगर इस्चेमिया बहुत ज्यादा प्रोलॉन्ग हो गया, काफी प्रोलॉन्ग हो गया, तो क्या होगा? What will happen then? Now this is the question, right? So क्या होगा? Now it will go into the process which is known as irreversible cell injury. The cell will get damaged completely. अब हम कुछ नहीं कर सकते उसका. Now क्यों होगा ये? Because the damage happens because of two things I told you. Mitochondria will get damaged and the cell membrane will get damaged. But ये damage करेगा कौन? ATP, when it gets reduced, the release of calcium in the cytosol, meaning inside the cell, will increase, जो कि नहीं होता है, normal condition में नहीं होता है. So the calcium will go high, and once the calcium is high, now this calcium has the ability to, activates all the enzymes. And I told you in cell there is one called as lysozyme. These are the enzymes which can destroy the cells. So it will not only start the activation of that, it will start all the other enzymes like phospholipase, protease, nuclease. Three important enzymes. Phospholipase, meaning enzyme, ACE means enzyme phospholipid, enzyme against phospholipids. Phospholipids makes the cell wall. So now the cell wall will get destroyed. Protease. Now this protease means the proteins. The proteins will get destroyed. And protein is present everywhere, in the cells, in the cell cytoskeleton में present है, organelles में, mitochondria में present है, ribosomes में present है, it will destroy that. Nuclease. Now nucleus, which contains the DNA matter, that will get destroyed. So the calcium has the potential. When the ATP or Cellular, if the ATP goes down, the ATP means energy production is down because oxygen is not there, and that condition if continues, then that will lead to excessive production of calcium. Excessive production of calcium will lead to activation of phospholipase, protease, and nuclease, and that will do damage to the cell, and that leads to irreversible cellular pathology. So, and there are three things. So now I'll tell you: decrease ATP, increase cytosolic calcium, then toxic ROS. Toxic ROS means reactive oxygen species. Now I have understood these three things in SORA, psychosis, and syphilis. If you want, you can understand this and you can remember also. It is very simple. अगर ATP ही just decrease हुआ है because the blood supply to the body has reduced. अभी एक सेल है जहाँ पे ब्लड आना चाहिए था, नहीं आ रहा है, तो नेचुरली एरोबिक रेस्पिरेशन नहीं हो पा रहा, एरोबिक फॉस्फोरिलेशन जिसको हम बोलते हैं, मेटाबॉलिक रिएक्शन नहीं हो पा रहा है, so that will get into anaerobic. ठीक है. Now this will lead to some functional changes. That is what Dr. Henneman talked about when he talked about SORA. SORA में there is always functional changes. So when there is a decreased ATP, so there is decreased functioning of ATP, decreased ATP production, that will lead to SORIC condition, where you will have functional disturbances. When there is increased cytosolic calcium, meaning when the calcium level in the body increases, there will be increased production of all the enzyme. If you understand psychosis, there is what? Proliferation, excessive production, excessive enzymes getting, So it's more of a psychotic. And later on is toxic, that is ROS. Now toxic meaning is that when a patient will produce deviation. Now here there will be production of reactive oxygen species which can damage the cells, especially by damaging directly the DNA. ATP में अगर आप देखो तो वो slowly हो रहा है. Cytosol is activating all the enzymes, protease, lipase, इस तरह से. But जो toxic ROS है, it directly damages the DNA. Nuclear के अंदर जो DNA मटेरियल है दैट इज गेटिंग डैमेज, मतलब द सेल के पास जो भी इंफॉर्मेशन चाहिए काम करने का, नहीं करने का, एवरीथिंग इज गेटिंग डैमेज, द सेंट्रल पॉइंट इज गेटिंग डैमेज. ऑलराइट, सो इट डैमेजेस द डीएनए. सो दैट इज मोर लाइक अ सिफिलिटिक थिंग. नाउ अ बॉडीज रिएक्शन will be determined like more on these aspects. Sometimes you will see that some patients take longer time to show a disease condition, probably because there is more of soric miasm, because the patient is soric in nature, so the patient is trying to fight it out. But when it is psychotic, there will be more of proliferative thing, allergic reaction. And when we are talking about syphilitic, the patient will be more showing destructive tendencies towards things. They will be more destructive. So it is again individualized thing that a person might show this type of reaction where the body will be trying to fight it out and show only the functional changes, nothing more. The second would be there will be proliferative changes, and third would be deviation from the normal. Okay, so then when we're talking about deviation, it is like total damage that is being done to the cell. So if you see the production of RAS, it has a direct damaging effect. ठीक है, और ये पहले नहीं होता है. Remember this, ROS does not happen just like that. As you understand, Dr. Henneman's, if you understand the theory of chronic miasm, you will understand that SORA is the first, then the psychotic, and then syphilitic layer. Okay, so first SORA functional changes, then the proliferative changes, and then the deviation or the destruction happens. So this release of ROS is the last thing that happens. Of course, there is cell death, but that happens because of ROS, and that ROS is the ultimate product which is being produced, and which is basically ये imbalance होता नहीं है बॉडी में. रिएक्टिव ऑक्सीजन स्पीशीज बनते हैं, बट फिर एंटीऑक्सीडेंट्स भी बन जाते हैं उसके अगेंस्ट में. ठीक है. नाउ when you are trying to understand morphological changes, because the last thing in any kind of pathological study is the morphology. There's a morphology में क्या change आ रहा है, right? So what is the change that is happening? So in reversible, it is atrophy. Okay, hypoplasia, hypertrophy. Irreversible में necrosis, gangrene, apoptosis. ठीक है. So now if you understand, अगर मुझे सोरा समझाना होगा तो सोरा is more of a functional damage. So it will be more atrophy, hypoplasia, where there is less of functioning. Okay, deficiency है थोड़ा कम हो रहा है functioning. Hyperplasia, hypertrophy is proliferative. Allergic hypersensitivity is allergic. मतलब आप body is producing excessive reaction to a stimuli. That is psychotic. And the irreversible may, when there is a destructive tendency of the body, necrosis, gangrene, and apoptosis. So this is how you will see that some patient who are having diabetes might end up having gangrene. Some might not have gangrene at all, might end up having a cardiomegalic, which is more psychotic in nature, right? And sometimes you will see some diabetic patient living happily, only having little functional disturbances, but nothing more. So this all depends upon the inherent miasm which is present in the patient. And that is, again, in pathology also they talk about the same, that it differs from person to person. How the person will react will depend upon this. So the miasm is basically two things, inherent and acquired. Okay, so inherent is which you get it from your family background, from your past history of your ancestors, their disease history, that will help you to understand, and that is something which you get from your genetic. आज के टाइम पे अगर आपको समझाना हो तो. Acquired में, now the body, how the body will, you are already born with the SORA miasm, or maybe you are mostly born with a psychotic miasm, but what will you show? What will be your way of showing it, or how will you react, whether it would be psychotic or not? Like जैसे मैंने आपको example दिया, मेरी मौसी में दो मौसी, they are similar twins, but one, she is no more, but the other mausi is surviving, and she, by God's grace, doesn't have any problem. So both of them are inherently having the same miasm, probably, right? But still, one had already reacted in a destructive way, and she is no more right now. Ulceration हुआ उनको, and then she got into malignant cancer, which is more of syphilitic trait. But my other masi, she is still alive. She is not having any other problem except for thyroid hair. So she is more in a psychotic miasm. So you can understand, So that depends upon, and that is acquired, meaning उसमें क्या काम आ रहा है? Nature and nurture. आप कहाँ पे रह रहे हो? What are your thought processes? What is the environment in which you are living? What is the food habits you have? What is the what are the medical history which you had, and how did you cope up with those habits? If you are drinking, smoking more, there are more chances of you getting affected with the disease. If you are having a healthy lifestyle, there are less chances of you showing that disease. And so if you understand, homeopathic approach is general classification of diseases: functional, proliferative, and degenerative, where it is SORA, psychosis, and syphilis. So syphilitic is more of an irreversible cellular pathology. Psychosis is more often, it's a change which you see, it is proliferative in nature, where there is increased sensitivity. So there would be more proliferation, like you see in allergy and hypersensitivity. And then you have functional, where there is functional uh, disturbances seen. So in short, if you pathology के साथ हम जाएंगे तो in functional it is immunodeficiency. Your immunity is little less, and that's why you are showing sardi, khasi, or some type of disturbances which is very functional in nature, not very deep rooted. Your organs are not affected, right? Proliferative is more like hypersensitivity, and where there is hypersensitivity and allergy will go into proliferative stage, where there is overproduction of or oversensitivity. All right. Degenerative is the disease condition which will be more like, which we term as autoimmune diseases, where your body is unable to understand your this is my own and goes into a destructive mode quite easily. वो जल्दी से उसी मोड में चली जाती है. So that is the general classification of diseases which Dr. Henneman said in his days, psoriasis, psychosis, and syphilis. And even today, we understand this in the very simple understanding of immunodeficiency, which is functional, hypersensitivity and allergy, which is proliferative, and degenerative, which is more of an autoimmune in nature, where the body is producing destructive pathology against itself. So this is what is psoriasis, psychosis, and syphilis. Blue, yellow, and red. So blue is more of immunodeficiency, where there is lack of functioning aspect, where the functioning is not well in your body. So remember in that way, blue. Remember, blue is psora. Function is less. So blue, cold, chilly. Patient is also very chilly. If you go through the psora patient ke sign and symptoms, it has been written by Dr. Henneman that the patient is very chilly. All right. And it's always the functional disturbances that the patient has. So it is blue. Then proliferative, there is increased proliferation or increased hypersensitivity to certain things. There are tumor formation. So that's more about loud color. So that's why yellow. So it will be easier for you to remember that way. And red is more of fire energy, which is about destruction, which can burn everything. So that is syphilitic, destructive, irreversible pathology like ulceration, necrosis. So this is the entire understanding of this. So remember, psoriasis is blue, psychosis is yellow, and syphilis is red. That will be easier for you to remember. And then you have also like the symptoms could be like irritable and angry, that is psora. Getting irritated and angry, that बहुत ज़्यादा लंबा चल रहा है, okay, that is psora. But वायलेंस, अभी मैं बहुत ज्यादा बोल रही हूँ और फिर आपने अपना मोबाइल तोड़ दिया या लैपटॉप तोड़ दिया, दैट इज वायलेंस. Okay, that will go into psychotic. Now आपको इतना दुख हुआ, इतना गम हुआ that either you kill me or you kill yourself, that is syphilitic, because the session is going long. So that is syphilitic. So you need to understand what are you. So with this, I hope you will be able to understand what is your understanding of psora, psychotic, and syphilitic. This was more my understanding of what I understood about psora, psychotic, psychosis, and syphilis, and in this relation to what is miasm. So I hope, and its pathological relation and microbiological relation. So with this, I hope I could do a little justice to the topic. And thank you for being very patient and hearing me out.
Thank you so much, ma'am, for such a wonderful session covering each and every aspect of pathology so wonderfully. I would like to request the audience to please pose the questions if you have any from Dr. Arpita, so that we can clarify your doubts. Anybody having any questions, please type in the chat box. I would request the audience, Dr. Ruby, the video would be available soon in 2-3 days on our YouTube channel at of Homeopathy 360. I'll send you the link of that channel in the chat box. I have already sent the link of the our YouTube channel. Uh, any questions, any queries? Yeah, we have a question from Dr. Vikram. What is the relation of disease with the constitution?
Okay. So when we are talking about constitution, we are basically talking about the physical and the mental makeup of a person. So depending on that, the disease, the predisposition of a disease would be determined. Now, to understand this, whether I would suffer from a disease would be to a certain extent determined by my constitutional makeup, because as I said, the constitution makeup meaning my bodily makeup and my mental makeup. So when we in homeopathy, when we try to understand the constitution, we try to understand mind as in the four the temperament in four aspects, that is sanguineous, bilious, phlegmatic, and melancholic. All right. So what is sanguineous? Sanguineous are, these are those people who are very active. They are very active. They are very alert. They are very reactive. So those are sanguineous. Bilious are more of a people who are intellectual. They are very have leadership qualities. They are very dominant types. And when we are talking about this phlegmatic, they are a little sluggish, laid down, very happy-go-lucky types. And the last one is the people who are melancholic, who are very depressed, take things very pessimistically. Now, for them, suppose there is a situation, like for example, there is a situation of sadness, a grief, like somebody died in the house. When it is sanguineous, okay, the sanguineous person, and when we are talking about the sanguineous person will take it very in a very casual manner. Fine, it happened, all right, and the person will come out of it. The bilious person will understand the thing that it is very logical, it is going to happen someday or the other, one has to die. So again, there might be a little anger or a rage, but then the person will slightly come back. The happy-go-lucky type will not have grief as such. Sadness would be there. In all of these three cases, there will be sadness. But the melancholic person might go into depression. There are high chances that because of the mental makeup of the patient, because he is pessimistic or she is pessimistic, they will think this is the end of the world. And they will go and try to commit suicide, or if not suicide, they will go into depression, insomnia, start thinking very pessimistically. So this is how the condition, one simple condition, that's about the mental disease I'm talking about. So similarly, that could happen in the physical aspect also. So the constitution, meaning the mental and the physical makeup of the body, will determine how your body will react to the condition. Because when you are talking about constitution, we also talk in constitution we had a hydropic constitution where it is mostly affected by the water, very much affected by water, where there is retention of water. So if you see, there are people who have cardiac problems. Some of the cardiac people will show more of a swelling in the legs and hands, but there would be other people having the same cardiac problem, but they will not show that kind of swelling. So that's because they are hydropic. They are more of a hydrogenic constitution where the retention of water in the body is more prominent. So that's the basic understanding of constitution with the disease.
Any other queries from the audience? Ma'am, there is a question from Dr. Shiva Ranjani. Many deep pathological diseases like cancer, hormonal disorders, autoimmune diseases are multimiasmatic. What
Yes,
do you say
that
about it?
yes, that's perfectly fine, sir. Shivaranjan ji, whosoever this person is, thank you so much for this question, and thank you for taking my focus there. That's actually the real thing. When we talk about the miasmatic diseases, because there are two types miasms. One is the single miasmatic diseases, another is the compound, where there is mixture of sora, psychotic, and syphilitic. And to understand this thing, we need to also understand. If you see the pathological books, if you study pathology in depth, you will understand one thing, that whenever we are talking about one disease condition, I'll tell you, for example, whenever we are talking about thyroid, especially when we are talking about hypothyroidism. Now, most of the time, the hypothyroidism is a result of an autoimmune. It's an autoimmune disorder where the woman, because of the hormonal imbalance or probably because of some stress, psychological stress, the patient is showing antibodies against her own cells, and that's why she is having hypothyroidism, right? Now, in this condition, the problem is only at one level, that is on the thyroid gland. But later on, the patient might have some other autoimmune diseases. For example, that can also lead to some other autoimmune diseases of the joints. So this is one understanding in pathology where they really do not know why it happens. But if we understand as homeopaths, we really understand that there are conditions wherein there are multiple miasms. The disease is not one dominant, but there are multiple dominant. There are multiple miasms like sora and psychosis would be there, and psychosis might be dominant, and sora might not be dominant, but it is still there in the background. Okay, so fundamental, or it could be fundamental, the sora would be the fundamental miasm, but the dominant miasm right now in this disease is more of psychotic. Similarly, there could be some disease where the dominant would be syphilitic, like for example cancer, malignant cancer, the dominant is of course the syphilitic, but in the background the patient might be having psychotic or sora as a functional miasm. So this is a possibility, and definitely because if we do not treat at the right time, as Dr. Animan said, if we do not treat the patient, then there are chances that the sora will get converted into psychosis and psychotic into syphilis. So of course, when we go back in treatment, then we have to start with the dominant miasm, which is present right now. We start with the syphilitic sora, with the psychosis, and then we go towards sora. So even the treatment will, the protocol will be also like that, depending on the dominant miasm which is present right now.
Thank you, ma'am. There is one more question. I think, can you explain the miasmatic progress of diabetes mellitus?
Okay. As far as this is Dr. Ronnie Dudwala. Thank you, sir, for asking this question. So, as far as diabetes mellitus is is understood, now diabetes mellitus is basically diabetes. When we talk about two types of diabetes. Type 1, that is diabetes insipidus, and diabetes mellitus, that is type 2, which occurs in adults. Now, that adult is more of a psychotic miasm. Now, I'll tell you why. And sometimes it is also considered to be like psychosyphilitic, but more prominent, if you see, it is the psychotic miasm. And the reason being that why? Because there is excessive production of sugar. The sugar is excessively produced. But then, why the sugar is excessively produced? Because there is less of insulin production in the body. So the production, insulin is produced less, and therefore the production of this is more. In certain cases, it could be also tubercular, where it is going from sora to syphilitic, where there is this autoimmune in certain diabetic condition. It could be also tubercular. Why? Because in certain cases, you will see that the patient has functional disturbances, which is excessive urea, polyuria is there. The patient has hunger. So these are the functional changes which you see. And the destructive thing is that the patient is having diabetes, more of sugar content in the body, is because there are autoimmune which are produced in the body, and autoimmunity as such is syphilitic. So those are going and destroying the insulin cells, which are beta cells. So the beta cells are getting destroyed. So this is syphilitic. So that is, again, sometimes it is tubercular also. So most of the time it is tubercular. Mostly what you see around us, the people who come to us, is mostly they are the tubercular miasm. They come into that category.
Any other queries from the audience? Ma'am, one more question from Dr. Rupam. Do suppressing the outer manifestations of the diseases with deeper pathology like thyroiditis could lead to a transformation of ongoing miasm to another?
Yes, that is very much possible. That if the ongoing miasm which is there, if we try to suppress this, we are actually trying to deviate it. And in pathology also, we study the same. See, first there is atrophy, where atrophy kab hoga? When there is no supply of blood or no supply to nutrition to the cell. That is atrophy. But I told you that always the cell tries to survive. Okay, so the second step it will do is compensatory. The second is like atrophy karte karte, the the cell will die definitely one day. So atrophy is not the solution. That it will go for hypertrophy, where it will try to increase the number and the size of the cell will increase, so that atrophied ho jayega. But there is deviation also in the phase of dysplasia and metaplasia, where the cell get transformed into some other way, ताकि वो अपने आप को एटलीस्ट सर्वाइव कर सके. दैट इज एडेप्टेशन दैट इज टेकिंग प्लेस. That's the pathological understanding, okay, of what is happening at the cellular level. But of course, if you say that if I am trying to suppress some disease, if I am not able to treat the disease properly, मतलब वही हुआ कि हम अभी वो एट्रोफी में हम उसको ठीक नहीं कर पा रहे, तो वो जाएगा हाइपरप्लेजिया में. अगर उसको ठीक नहीं कर पाएगा, it will go in a deviated form. The deviation would be in metaplasia or dysplasia. Right, so definitely if we are suppressing one disease condition like thyroiditis, it will lead to some other manifestation of the miasm later on. The manifestation would be definitely changed and it would be a more destructive one.
Any other questions, ma'am? Dr. Sandeep is asking at which point cell goes into reversible cell injury to irreversible.
Okay, reversible to irreversible. Basically, I told you about there are three things you have to remember. Reversible cell injury से irreversible तभी होगा अगर ये तीन चीजें रहेगी. One is the type, which type of cell is getting affected. ओके तो वो कौन सा टाइप ऑफ सेल है. सपोज अगर आप ब्रेन सेल्स की बात कर रहे हो, 4 minutes ऑक्सीजन नहीं सप्लाई होगा, इट विल गो इनटू नेक्रोसिस, द सेल विल डाई ऑफ द ब्रेन 4 minutes. सो दैट डिपेंड्स अपॉन, आपको याद रखना है लाइबल सेल है कि वो परमानेंट सेल है या स्टेबल सेल है. इन पैथोलॉजिकल कोरिलेशन में आपको ये याद रखना है कि व्हाट इज द टाइप ऑफ द सेल. देन सेकंड यू हैव टू रिमेंबर द ड्यूरेशन, कितने ड्यूरेशन तक है. रिवर्सिबल सेल इंजरी मतलब तब है कि आप रिवर्सिबल तब तक कर सकते हो जब तक वो ड्यूरेशन बहुत लंबा ना हो. इफ द ड्यूरेशन ऑफ द डिसीज इज फॉर अ लॉन्गर पीरियड, very long, then there are high possibility that the cell will now go back into a condition in which there will be damage to two things. I told you already, damage to two things happen in irreversible: damage to the mitochondria and damage to the cell membrane. एक बार ये हो गया तो हम उसके बाद वापस नहीं आ सकते. तो आपको याद सिर्फ ये रखना है कि ये दो चीजें नहीं होनी चाहिए, माइटोकॉन्ड्रिया का डैमेज नहीं होना चाहिए और सेल मेम्ब्रेन का डैमेज नहीं होना चाहिए. अगर वो हो गया तो हो जाएगा. सो आपको टाइप याद रखना है कि सेल का कौन सा टाइप है. तो अगर वो परमानेंट सेल है, जैसे आपके ब्रेन सेल्स, दे आर परमानेंट, दे कैन नॉट रिप्रोड्यूस अगेन. सो वो अगर डैमेज होगा, यू कैन नॉट डू एनीथिंग अबाउट दैट. So that is, it's very fast. So then type, and what is the kind of injury and the severity. And last one is the severity. Kitna severity hai, how severe is the problem, that is also that also matters. So if the severity of that ischemia is more, severity of the ischemia is more, मतलब आप सोचो इतना बड़ा सा एक thrombus है that goes and blocks the blood vessel. So now the blood is not able to come, वो block कर दिया उसने. So this is अब वो blood आ ही नहीं पा रहा, तो it will, the cell will not get the sufficient amount of blood. It will not be able to produce the ATP. Naturally, there will be cell death at the end. Okay, so depends upon the severity, कितना severe है. ड्यूरेशन भी मैटर करता है. अगर किसी को चोट लग गई, अभी आपको एक्सीडेंट हुआ है और ब्लड लॉस हो रहा है, और आपने 2 घंटे उसको पेशेंट को ऐसे ही रखा, थोड़ा थोड़ा ब्लड लॉस हो रहा था लेकिन हो तो रहा था, 2 घंटे आप ऐसे ही छोड़ दोगे तो वो थोड़ा थोड़ा विल बिकम big in amount, severe. So that is the duration. So you have to also remember the duration. So 3 things you remember: what is the type of cells or the type of the organ which is being affected, type of the organ, whether it's the brain or the heart which is being affected. Second, what is the duration, and third, what is the severity. If these 3 things are on the higher side, definitely irreversible.
Any other questions? Miasm behind cyst in ovary, ma'am. There is one more question from Dr. Ruby.
Okay, thank you, Dr. Ruby. This miasm behind cyst, if you see, there is proliferation, meaning there are ovulation taking place inside the ovary. But unfortunately, in the ovarian cyst, what happens that after the ovulation process is where the cells are getting bigger in size, the ova is getting bigger, but that ova is not getting released from the ovary. It is staying inside the ovary. So it is more of a, what you see, proliferation. So that's more, if you understand, that's more into psychotic miasm. Proliferation is there, but it is not coming out. Ovulation is not happening. It is happening inside the ovary. So that is why there is cyst. That's more of a psychotic miasm.
Any other queries, ma'am, regarding the case of hypothyroid? They are also asking miasmatic approach.
Yeah. Uh, See, basically, it will depend on the hypothyroidism. If it is because of autoimmune factors, if there is an autoimmune factor responsible, so it is going more in a syphilitic way, you know, because autoimmunity meaning आपके ही body में antibodies are produced against the thyroid cells. So if there are antibodies which are produced against against your own cells, against your own thyroid cells, so definitely it is going into a syphilitic miasm. So it depends upon what is the cause. So the cause, if it is an autoimmune cause, then that. If hypothyroidism, it is basically because of iodine deficiency, like what happens in goiter. If it is because of iodine deficiency, then in that case, it is more of a functional disturbance, functional miasm, सोरा है उसमें. So if you start giving the patient goiter के लिए आप अगर उसको iodine देने लगोगे, the patient will be fine, right? But if the goiter has advanced to a stage where it is where irreversible pathological changes have taken place, like the gland has become bigger in size, nodular in very much nodular, बड़ा हो गया है, ऐसा हो गया है, and it has become like we have to go for surgical intervention because इतना बड़ा हो गया कि now it is pressing on the structures like pharynx, larynx के ऊपर वो pressure दे रहा है, right? Compression कर रहा है, and the patient is unable to eat or drink because of that thyroid which has become nodular now, you know. तो अगर वैसा हो गया तो we have to go for surgery, and which is now psychotic in nature, more of a psychotic in nature, and now this is causing destruction of the other things around. So it depends on what is the cause of the disease. In hypothyroidism क्या cause है?
Any other queries, ma'am? IBS, irritable bowel syndrome. They're asking
हाँ.
miasmatic progression.
As far as IBS is concerned, again, irritable bowel syndrome. If you go back, it's again there is autoimmunity and there are stress. Okay, so if it is just related to stress, more of stress is related. That is a factor which is causing that IBS. Because if you see we do not actually know the basic mechanism what causes IBS. So if you go through it, you will just understand that basically IBS is because of stress, or it could be because of autoimmunity. But normally, it's the main factor which you see is the stress oriented. And if it is stress oriented, more of a psoric in nature, which can be treated with drugs. And with homeopathy, I've seen very good results in IBS, because IBS, if it is related to stress, I'm talking about. If it is autoimmune, then probably there's an autoimmune factor. Then of course it goes to the syphilitic trait. It could be tubercular also. So from if there are certain patients who can show traits from SORA to syphilitic, so there could be tubercular as well. So it depends on what is the fundamental miasm behind that. So the fundamental miasm and the dominant. So the dominant, if the dominant is more of psoric, so there are high chances that with our treatment the patient will get better because functional disturbances. But if it has progressed into a stage where it is more destructive, autoimmunity is there, then it is when the dominant becomes syphilitic, then it becomes a little difficult. But of course we can take up the case and we can try.
Thank you, ma'am. I hope that everybody has clarified their doubts. Still, ma'am, please type your email ID in the chat box or your contact number for people to contact you if they have any queries.
All right.
Also, I want to update everybody that we'll be uploading this webinar recording on our YouTube channel. So you can visit the YouTube channel to view the recording. There are more questions I know from Dr. Nikita and Dr. Uzma. There are many questions which are coming up, but I think we are short of time. It's already 5. If you want to discuss, ma'am, 1-2 questions we can discuss. But if you want, if they can ask them personally, that it would be great. Want to go for more questions, ma'am?
I'll just ask them to just mail me up because there are many questions coming up. So I would be
Yeah.
happy to answer you there, and definitely I'll answer you back. That's my email
Uh,
ID. I've already given it on the chat
because
box. So,
miasm is such a vast topic and such a we need to focus on so many things plus explain so many things. It needs another lecture. I think miasm is a very long topic. So
it's a very
you can contact personally to she's typed her email ID Arpita Chatterjee 29@gmail.com. So you can contact her personally for all the queries. I hope our audience understands that because of the shortage of time, we cannot discuss so many questions. So I think we come to the end of this session of today, and it was great to learn from you so many things, ma'am. Thank you for such a wonderful explanation on pathology, covering each and every aspect. Matlab, there was so much to learn today, and absolutely we have very good comments. I would like to share a few of the comments even from the audience which we have got. Like they have said there's a very good comment from Dr. Kunjal: susceptibility, individualization, potency, miasm correlated to modern pathology are such points that if our surgeons and MD physicians see this lecture, their thought process would be transformed. This was such a wonderful comment which I wanted to
thank you.
share. And like there are many other comments which people have posted, and it's like it's always good to learn, and so many things you've explained so wonderfully. So my heartful thanks to you, ma'am, Dr. Arpita, from my whole team of Homeopathy 360 and BGen group of companies. So thank you so much, ma'am, for your valuable time and guiding the audience.
I thank
And
you. I thank
my
you
heartful
personally, and I thank Dr. Rajesh sir and Vikram sir and all the entire group of BJN and uh, 360-degree homeopathy for giving me an opportunity. And of course, I thank my Parul University faculty members for being such a wonderful blessing in my life.
Actually,
Thank you so
ma'am,
much.
we are thankful to the Parul University because we had so many lecturers in the past 1 month from Parul University, and it has been so great to learn from each one of them. That like every other lecturer had a very had a great point or some unique point that people got to learn so much from many of the faculty members of Parul University. It was great to be it is a great pleasure for Team Homeopathy 360 and BJN to be associated with the university. Thank you so much. There are so many people you already named them in the start: Dr. Purav, Dr.
Yeah.
Hitat, Dr. Hina ma'am, and numerous people who have been with us since so long. Dr. Panda sir, they have been associated since long. So thank you so much for being with us and
Thank you.
uh, coming to this platform to share your knowledge. And also, I would like to thank all the learners who have been with us today for their patient listening and such a nice audience. Before I sign off today, let me thank my whole team of Homeopathy 360 who have been working day in and out for these webinars, for bringing out each and every information related to homeopathy, to update the fraternity about each and every update. Thank you, everyone. We will be uploading this recording on our YouTube channel. If you have any queries, you can mail us at webinar@homeopathy360.com. And also you're requested to follow our social pages on Facebook and Instagram and Twitter and LinkedIn for all the updates. Stay connected with us, keep participating likewise. We also have a webinar tomorrow. I would also share the link with you all people. Tomorrow's webinar plus we have a series which is about to start on 6th of June with the Hahnemann Forum on live behavioral materia medica. So I'll just share both the links with you all, which the webinar we are going to organize. Tomorrow is the webinar on evidence-based practice in homeopathy, And from 6th, we are launching another webinar of HHF. So I hope HHF is already popular so much, and there is a lot to learn from them. Their whole team is coming to this platform. We are lucky to announce that too. And I've posted both the links which you can visit in the chat box regarding tomorrow's webinar by Dr. Vipul Shastri, sir, from Surat, and he'll be discussing on evidence-based practice. Plus, we'll be having a complete session of 4 days with HHF on live Materia Medica. So I hope everybody can register for the same. And if you have any queries, let me know on at webinar at homeopathy360.com. We'll be happy to serve you. Thank you so much. We come to the end of the session. Thank you, ma'am. Thank you,
Thank you.
audience. Thank you.
Thank you so much. Thank you, all the audience. Thank you.